Madam Chair, thank you so very, very much. This has certainly been a super exciting 4 weeks for you as chair and for all of us. And after about 15 months on the job, I can tell you that this has just been about the kind of pace of being president at the University of Louisville. And I hope that every year we're actually able to create this kind of excitement around something so positive for the community. Before I share our news, I really want to thank each and every one of you that's here today. There's a lot of people who played a big role because this all came up so fast who are not here today, but I want to acknowledge each and every one of you. This is a really important moment in the life of the university, of the city, and of the Commonwealth, incredibly important. There are very, very, very few times in our lives on our human journey when we are together able to take a risk, a big risk, granted, but to do the right thing for the right reasons and to find so much support for it. And I'm so grateful. You will hear some of them called out, but I'm so grateful to this Commonwealth that clearly shows that united we stand. We're living by our motto today. And that brings me to our announcement today. I don't know if any one of you will be surprised, but I really would like you to act surprised for me. In the special Board of Trustees meeting just now, the University of Louisville Board of Trustees voted unanimously to acquire the Louisville area assets of KentuckyOne Health, including the struggling Jewish hospital. The board of KentuckyOne Health's parent company, CommonSpirit Health, voted in support of this transaction yesterday. We hope to have all regulatory and church approvals to be granted in the next 8 to 10 weeks, with a final closing date of November 1. To be specific on the terms of this deal, UofL will be acquiring the company's employees, that's the physicians, nurse practitioners, medical, non-medical staff, and the physical assets, including Jewish Hospital, Fraser Rehab, St. Mary's and Elizabeth Hospital, Our Lady of Peace, Jewish Hospital Shelbyville, and the outpatient medical centers, Jewish East, Northeast, South, and Southwest. The purchase price, yes. The purchase price is $10 million, but CSH is for giving the university nearly $20 million in notes payable from us to them. In this way, the net of this deal is actually about $10 million in our favor, and we appreciate that. Additionally, we will get about a little over $75 million in accounts receivable and in cash to use as immediate working capital to help with this transaction. You may be wondering, how did we get here? Normally, in press conferences, we don't have such a long monologue from me, but I ask you for your patience because this is so important to so many. We know that the KentuckyOne Health Louisville area assets have been on the market for nearly 2 years. And we, like you, were waiting for a private sector solution. UofL engaged in informal conversations with KentuckyOne Health starting in late 2018. And we were in formal negotiations with them since early 2019. Many of you remember that we walked away from the deal in mid-June 2019 because we did not have the time or the ability to identify a suitable partner. At the time, we knew that Jewish Hospital might close, but we expected it to be several months away. And we hoped that that would give us time to transition our services without interrupting patient care. So what changed? Last month, KentuckyOne Health suspended the heart transplant program at Jewish Hospital. This was unexpected and a clear indication that now an out-of-state company was not going to be able to operate the hospital here much longer. Then we learned shortly after that, about August 1, that the closure of Jewish Hospital was imminent, that there would be a deal announced actually tomorrow of sale of the other assets, but that our indications were that Jewish Hospital would be announcing closure and probably be closed in a couple of months. Key faculty have already begun to leave because of the uncertainty around these facilities. And we were concerned that a mass exodus would occur if Jewish hospitals' closure was announced. And that's not just our people. As far away as in Shelbyville, there's so much anxiety about what will happen. So why are we choosing to act? First of all, we are a public university, and I strongly believe that public universities are mission-based organizations, and we must be committed to the public interest and public trust. Our missions are research, teaching, service, and through our clinical enterprise, patient care. Our mission requires us to do what is right, not just for the University of Louisville, but for the people that support this institution, for all of the citizens of the Commonwealth, and all those who rely on our university as a source of economic and personal growth. Let me put it very simply. There's a lot more here, but I'll just cut to the chase. Jewish Hospital is just too important to this community for us not to act. Let me give you some numbers. These are sobering statistics. The Louisville area KentuckyOne Health system sees more than 2 million patients a year, has nearly 40,000 emergency room visits, and employs more than 5,500 people. Those are real lives that would be affected. We could not sit idly by without at least trying to be part of the solution. We know this is a risk for the university. We are doing this because we feel we must. We also do believe we can do it successfully. I've told you many times, when you're flying on an airline, you're told, if you need to save somebody, put the mask on you first before you help the next person. Over the past 15 months, I feel much more confident today about our ability to execute this successfully. So despite the financial woes at Jewish, our confidence is in our leadership team, and there's so many people I could single out, but certainly our CEO of our health system, Tom Miller, our CFO, Dan Durbin. I should stop because there's so many people that I would call out. I would like to tell you that in the past few months, under the leadership of Tom Miller, we've had a remarkable turnaround at our own university hospital. That was important. We needed to be in good shape before we could help someone else. In just a short period of about 8 months, we've had a $90 million improvement in our EBITDA, a swing from negative to positive. We've made improvements in management, operations, and care. So, does this make sense for the University of Louisville to do? We know that it matters to the community. I've told you, just at Jewish Hospital, there are about 3,000 emergency room visits, a little over a month, and about 19% of them need to be hospitalized that day, and there are no beds available here. Why does this make sense for us? Critical role of the university in providing quality care to the community. A town-gown relationship is something we take seriously. First, our education mission. Right now, we have about 60 residents who are at Jewish Hospital and count on it for furthering their education experience and becoming the best healthcare providers they could be. Research. We are so proud of the research that's happening here. Oh my gosh, I see at least 2 or 3 of our bright spots here. There's so many. If I missed you, don't take it amiss. I love you all too. So I see Dr. Susie Harkama, I see Joseph Niemat, I see Aruni Bhatnagar, among the many, many people. It's just they're perfectly lined up there. I can tell you that they will tell you that without these facilities, without access to these facilities, the important work they are doing is at jeopardy. And that means our research standing as an R1 institution is at risk. Patient care. This is incredibly important to us. And we are concerned about the financial impact. We are only as healthy as the Commonwealth is. And a payroll of about over $300 million is what we are talking about in this acquisition. But none of this would have happened if we didn't have the right partners. We told you from the get-go, given the deep losses and the lack of private enterprises stepping up for this, that this is a risky proposition. And we did find the right partners. You will hear about many, many people who played a significant role, but there are a couple that I really want to call out. This was broad, bipartisan, public and private sector support. In order of how these meetings happened, this is serendipity. On July 25th, that was about 3 weeks ago, tomorrow I think, I had a scheduled meeting with Senate President Robert Stivers. And it was a casual conversation. It was supposed to be to talk about preparing me for the upcoming budget session. And we started to talk about what was happening in the healthcare arena that led to conversations with other leaders. So Senator Stivers is not able to be here today, but please, all of you recording this, make sure you acknowledge that I thank him for his leadership and vision. But even with that, nothing would have happened, candidly, if it hadn't been for a meeting with Governor Bevin on August 1. And that's how fast this all moved. And Governor Bevin and his administration, I know they don't all want to be called out, and there's so many people, but certainly the cabinet secretaries, Brinkman, Serene, Meyer, thank you all so much. But the governor, in our conversation, talked about how we had waited and seen if there would be a private sector solution possible. But he said, failure is not an option here. There are too many lives at stake. Thank you for your commitment to support the $50 million economic development loan that will allow us to keep these more than 5,500 jobs in the Commonwealth and continue to provide quality care to our citizens. One more thing I want to say is that part of it is a forgivable loan. And what I appreciated about the entire leadership, I will walk through the rest of them in a minute, is that the conditions were not just about retaining jobs, but that we retain jobs for Kentucky residents. And the other condition, another path, was that we improve the quality of health care in West Louisville and other underserved areas, West Louisville, South Louisville, other areas. So I really appreciate that commitment. Speaker Osborne, thank you, sir. Thank you so much. And I want to say a special thank you to the Republican and Democratic leaders, including Minority Floor Leader Rocky Adkins in the Kentucky House of Representatives, for your thoughtful consideration. Your letters of support, your words of support really were key for our board in getting over the hurdle of how much risk we were assuming. This was public and private partnership. We were challenged for the $50 million loan to find private sector philanthropic support. And I want to say a special thank you to two foundations. One, to the Jewish Heritage Fund for Excellence, and for all of the board members, the chair and the board members. Thank you so much for stepping in to help us to prevent the closure of a facility that is deeply connected to this community and to the lives of both of our organizations. Your $10 million gift makes today possible. Thank you. I also want to say, to the Jewish Hospital and St. Mary's Health Foundation, thank you. We are deeply, deeply grateful. Their $40 million gift will enable us to work over the next 3 years to turn this hospital system around. They pledged $40 million, $10 million a year for the next 4 years. So thank you most sincerely to the chair and board of the Jewish Hospital and St. Mary's Foundation. Almost done. Attorney General Andy Beshear, Metro Council President David James are among the many that have been a source of support. We appreciate you. I am not calling out every name, including those seated near the podium and those in the audience, but I will personally thank each one of you. Before I turn this over to Governor Bevin, who really did make this possible, I want to sincerely thank my team. They have spent days and nights and weeks and months trying to be part of the solution. There are so many, and I'm afraid I won't name all of them, but Jerry Bradley and Mary Ann Mallory for starting to do the investigation into why this mattered, why we needed to step up. to Tony Gansel, Jason Smith, Kelly McMasters, Jeff Bumpus, for your leadership on the Health Sciences campus. Shannon Rickett, Michael Wade Smith, Jake Beamer, Victoria Scholes, all of you, I promise we'll take a power nap this afternoon. 30 minutes is what you get. And my deepest thanks to Tom Miller, Dan Durbin, Tom Hoy, Jenny Davis, who worked so very hard, and there's so many more that I know I'm forgetting to thank. We will have more time to reflect on this as time goes by. And I promise you, I and my team, we will do our best by this community for this trust placed in us. I do hope this brings some stability to so many people who were uncertain about their jobs, and to so many patients who were worried about the care they would get. Thank you so very much, and go Cards!